What happened, Karen Davenport?
Well, I think with the debate, you see the bumps in the road that any kind of major legislation experiences. And I think even starting with the Recovery Act in February of last year, there was a sort of lead up to how healthcare was going to play out, as there were a lot of debates around research that looks into which treatments work and which treatments don't, and how that particular part of the Recovery Act was portrayed in the media. And I think, what a lot of the focus of the story has been is are the political bumps in the road, who's talking to whom, when is the Senate going to take something up, rather than the substance of the bill. And I think that people have really been turned off by the political machinations that are part of major legislation, rather than the substance of what policies were being proposed.
So did you guys break out the champagne at Heritage? High fives and chest bumps all around?
No, absolutely not, right? And I think I think the misconception is out there that a lot of people don't want to do anything about healthcare reform, but I absolutely disagree. I think there's a lot of waste and abuse. I think it's also unconscionable that as a country as wealthy as ours has people who don't have health insurance and who are afraid of getting sick because they'll have to pay everything out of pocket. So I think there absolutely has to be some type of reform. But to go to your question, I think what happened was it was too ambitious. The politicians on Capitol Hill were guided by trying to meet arbitrary deadlines, and it was too complex, and they didn't do a good job of explaining what was in the bill. And probably the most obvious question is that the economy and unemployment was the biggest thing that people were concerned about, and instead Congress and the president focused on healthcare.
It's interesting that you use the phrase arbitrary deadlines, because now, looking back at how the last year went, there doesn't seem anything arbitrary about those deadlines. It's obvious why the president wanted it done in August, or wanted it done by Thanksgiving, or wanted it done by Christmas. And I think the symbol of that is Senator-elect Brown from Massachusetts. When that election happened, the ground underneath everyone's feet shifted, and now those deadlines look like they might have been a pretty good idea, because if the draft bills had been done in the summer, well, his election might not have made that much difference.
Well, I meant more arbitrary in like political deadlines. I mean, it was political calculations that were motivating politicians to try to get healthcare reform passed. Like you said, trying to go before August so they can go to their congressional districts and talk about healthcare, that they pass healthcare, or before Christmas, another opportunity. So that's what I meant by trying to do that in those times.
Michael Cannon, we buy healthcare in a different way from the way we buy almost anything else. I try to think of a comparison, and it's hard to come up with one. You couldn't go to a supermarket and look at a shelf full of soups with no prices and no ingredients, and somebody else standing between you and the soup saying, "I'll take this one," and charge you more for it next week and more the week after. With a system that so many people don't like, how come that industry was able to motivate so many people to defend it?
Well, I think there's a misconception in your question, which is that the industry opposes this legislation. If you look at the hospitals, you look at the doctors, the drug manufacturers, even the insurance companies support this legislation because the president and the leaders in Congress have promised them lots more revenue if this legislation comes to pass. And that's because, a lot of people, we saw them in the segment, a lot of people are struggling with the high cost of healthcare right now. But this legislation doesn't actually reduce the high cost of healthcare. All it does is it shifts those costs from the premium payer to the taxpayer and forces a lot of people to spend even more on healthcare, and that's why all those interest groups were actually happy with this legislation. And that's but at the same time, I think that's one of the things that turned off the American public. I mean, you spoke about deadlines. I think another reason why the president kept setting these arbitrary deadlines is because the people have been either a plurality or a majority of the American people have been opposed to this legislation since July. That's since July of 2009. That's before the town halls of August, and before most of the deals that turn people off, like the Cornhusker kickback, the Louisiana Purchase, all these deals with the industry. those things helped turn the public even more against this legislation. It grew more and more unpopular by the day. And actually, I think that people will say, well, that's just the process that people are getting upset with. And we're not talking about the substance of the legislation. In fact, I think that the process here is the policy. Because what this legislation would do is give even more control over our healthcare decisions to politicians, to special interest groups. And so if this legislation becomes law, we're going to see more and more of these political deals for the foreseeable future, because that's how things are going to get done in healthcare. I think there are better ways of getting things done than this legislation, reforms that would be perhaps more incremental and that would focus on innovations that make healthcare better and less expensive, and that brings down the cost of healthcare for everybody.